What is melatonin?
Melatonin is a hormone our bodies produce naturally to regulate sleep. It helps set our internal clock, telling us when it's time to wind down. Melatonin supplements are often used as a gentle sleep aid, especially for shifting sleep schedules and easing jet lag. Understanding how melatonin works is key to using it safely and effectively.
When to consider melatonin supplements?
Melatonin may help if you have trouble falling asleep, frequent jet lag, or work night shifts. It's also sometimes used for specific sleep disorders in children or older adults. If poor sleep is tied to anxiety, depression, or medical issues, it's best to consult a healthcare provider. Melatonin is not suitable for everyone or meant for daily, long-term use.
How to use melatonin safely?
For most adults, starting with a low dose, usually 0.5 to 3 milligrams, 30 to 60 minutes before bedtime, is recommended. Higher doses don't always lead to better results and may cause side effects. Only take melatonin when you plan to get a full night's sleep and avoid driving or operating machinery after taking it.
Potential side effects and interactions.
Melatonin is considered safe for short-term use, but side effects like drowsiness, headache, or dizziness can occur. It may interact with medications for blood pressure, diabetes, or depression. Children, pregnant or breastfeeding women, and people on certain medications should consult a doctor before trying melatonin.
Healthy sleep habits and alternatives.
Before reaching for melatonin, try habits like keeping a consistent bedtime, limiting screen time before bed, and creating a calm sleep environment. Regular exercise and managing stress also promote better sleep. Melatonin works best when combined with good sleep hygiene, helping you rest naturally and wake up refreshed.